The practice module is the highlight of our program, and it's an opportunity for the students to combine what they've learned throughout the year with the real world problem solving. And the idea is that urban health as an interdisciplinary field brings different disciplines and subjects. And the practice module itself is a great opportunity to work with partners, to work with other academics, to work with communities around issues of urban health. This year we went to Belfast with our students. It was a very interesting experience because Belfast is a city that went through many years of violence and conflict. And the situation there, even today, is not very, very stable. So the question that we asked ourselves is how the conflict and post-conflict affect the health of the different communities in Belfast. And this is a very complicated question with a very complicated answer. But the idea was to try and to understand how the conflict affected planning and urban policy in the city, and how urban policy and planning affect the health of different communities in the city. What was very interesting to learn is that conflict is not the only issue that affects health in Belfast. Poverty, deprivation, different spheres of violence in the city, in the neighborhood, also affect the health of communities and individuals in the city. In Belfast, we worked with different organizations and partners, such as the Belfast Healthy City Network, which is an arm of the WHO, and it was a great opportunity to share with them our expertise, our students' work, and we hope that we also contributed to their work.
As part of our fieldwork, we looked at 4 distinct topics. The first group looked at car dependency, focusing on how politics and social tensions impacted movement around the city and transportation. The second group looked at access to healthy drinking water, specifically leaded water pipes and its impact on childhood development. The third was on childhood obesity. This group looked at access to green spaces and what they refer to as healthy places. And finally, the fourth group looked at a community development model named the Care Zone Project, aimed at reducing health inequalities, and their focus was specifically on mental health.
Our group was exploring mental health and well-being in urban planning in a neighborhood in North Belfast which suffers from really difficult mental health disparities. We were doing that by both exploring it through 4-pillar theoretical framework and using some tools to help us kind of map the way people feel in their built environment. So where do they feel safe, where do they feel unsafe? And when we actually came to Belfast, we were working with a project called the Care Zone, which tries to build a community spirit around issues of well-being, and we were kind of talking to them about our findings and trying to understand why people feel safe in specific places.
And in terms of the fieldwork itself, we were able to engage in a range of activities and research methods. We had guest speakers and discussions with healthcare professionals and experts in the field of health and urban planning. We also engaged in city tours and walking tours that covered both politics and urban planning in Belfast. And in the days on the field itself, students were able to conduct surveys, interviews, and mapping activities with local residents.
We are here in South Belfast doing surveys about people's perceptions of the quality of their tap water. We're hoping to find out what people think about their tap water, and it's linked to a study that we're doing about lead pipes in the water infrastructure in South Belfast.
So we use the Maptionnaire platform, which is a really cool application where you can kind of use a map and you send it to people through a link, and they can just point out on the map different locations. And then when we actually came to the field, we interviewed residents, we did some tours of the neighborhood and some focus groups with people that work for the Care Zone in the area.
This all culminated into a final presentation at the end of the week where students shared their findings and analysis.
I think what we found out first is that care and compassion and the way people interact with each other is probably the most important thing, and that building trust between organizations and between the government towards its citizens is the most important thing in order to, to build the capabilities of institutions to actually address issues of mental health. Because if you just build a nice park, it's not actually going to benefit anyone unless you actually talk to the people and bring them into the conversation and make them feel responsible for this space that is being created. Why it's really special is because you learn throughout the year all these theories about health in urban development, and when you actually come to the field with all these ideas, you see how sometimes in the field completely new things come up, and all these theories that you studied are actually might be relevant in some ways, but are also kind of mended by the conversations with the people in the space, and getting feedback from actual practitioners that work on this specific subject of well-being in urban planning was really, really interesting, because in every place it's completely different. So we came with this theoretical framework, but what we actually talked to the people, we realized that in many ways they found it very interesting and relevant, but also in other ways they found it maybe a little bit dry. And then when we get these like two perspectives together, I think the results of our very short experience were actually really important.
So the final reports of our students will be shared with our partners in Belfast as a way to work together towards the design of some recommendations of intervention in urban health in the city.
It's also a really fun way to get a new type of interaction between the professors and the students, because when you are in the field you get to have more informal conversations about the things that are important to us, which was also really, really amazing and important for the experience of this program.